Good afternoon. My name is Loren Robinson. I'm a second-year scholar at the University of Pennsylvania Robert Wood Johnson Foundation Clinical Scholars Program. I'm honored to be joined this afternoon for this podcast by Dr. David Satcher, who, among his many accolades, is an alum of the Robert Wood Johnson Clinical Scholars Program at UCLA, has also served in leadership roles as the president of Meharry Medical College, also has served as the director of the CDC, and simultaneously served as the Assistant Secretary for Health in the 16th Surgeon General of the United States of America. Dr. Satcher, we're honored to have you with us.
Delighted to be with you, Loren.
This afternoon, I'd like to chat with you a little bit about Medicaid expansion and health policy.
Okay.
As you well know, there are 23 states that elected not to expand Medicaid, and in this era of the Affordable Care Act moving forward, don't you find this inhumane that we have so many people who will suffer in these states, most of whom are minority and underserved, and how can we continue to serve those populations in these states where Medicaid did not expand?
No, I agree. I think the problem started in Washington in terms of the lack of agreement in Congress. But I also think, despite that, we found ourselves with the Affordable Care Act, tremendous opportunity to expand access. But expanding Medicaid is key to that, and it requires cooperation from the states. I do think, considering the number of people who are excluded from ready access to health care because they don't have insurance, not to take advantage of this opportunity to expand Medicaid, when the state's a portion of that cost would be less than 5%, and yet it was an opportunity to get millions of people who've been shut out into the health systems, because we now know that the Affordable Care Act has dramatically reduced the uninsured, more so than anything, and certainly since Medicare and Medicaid, nothing has had the impact on access to health care that the Affordable Care Act, and we're just still beginning.
True.
And already we're seeing, especially for African Americans and Hispanics, we're seeing dramatic declines in the uninsured.
And thinking beyond Medicaid expansion, what health policies do you see as essential, or what changes do you think need to be made in health policy to truly achieve parity and equity for the underserved?
Well, there was something in the Affordable Care Act that never gets talked about, which I think is critical, and it's the prevention agenda. It was developed by a group of people in government from all sectors. It was not just health care, it was education, it was commerce, justice. All of them met together for over a year, putting together this so-called prevention agenda. And the beauty of it was that it included social determinants of health. In other words, if you say, people in this community don't have anywhere where they can safely be physically active, the Affordable Care Act, through the prevention agenda, would have funded programs to change that. It would make a tremendous difference if it were fully funded. But from the beginning, Congress has not fully funded that aspect of the act.
So the best is yet to come then.
I hope the best is right around the corner.
Well, Dr. Satcher, thank you so much for your time today, and we really appreciate it.
You're quite welcome. It's been great being with you.
Thanks.